Hello everyone, good evening. It's Dr. Miles. Today we're going to talk a little bit about medications that are used to treat depression, as well as some of the nutrients that those medications can deplete. So first we're going to talk about SSRIs. So a few examples of SSRIs, or selective serotonin reuptake inhibitors, which are used to treat depression. A few examples of that would be fluoxetine, which is also commonly known as Prozac. Again, I would always encourage you to know the generic brand name of your medication, because then you can start to see which class of medications they're in versus just a brand name, and you can't really track that as much. So Sarafem is also another brand name for fluoxetine. Escitalopram, which is Lexapro, and fluvoxamine, which is Luvox. Another medication class within the medications that are used to treat depression would be those that are considered selective serotonin and norepinephrine reuptake inhibitors. So duloxetine, also known as Cymbalta, venlafaxine, which is Effexor. And then lastly, tricyclic antidepressants, or TCAs. So that would be your amitriptyline and doxepin. So some of the nutrients that are depleted by SSRIs would be CoQ10, magnesium, melatonin, B2, vitamin B2, vitamin B6, vitamin B12, and folate. The SNRIs, again, CoQ10, magnesium, B2, melatonin, B6, B12, and folate. And then tricyclic antidepressants deplete CoQ10, B6, B12, and folate. This list is not exhaustive, but I just wanted to go through a few nutrients that antidepressants can deplete. And so what you will see is kind of the same trend as some of the other medications we've talked about in the past for treating the medications used for treating hypertension and diabetes. You'll see kind of the same trend here. So we're going to just talk about a few of these. The first one is B2, vitamin B2, also known as riboflavin. So this helps your body produce energy by breaking down calories. So it helps produce red blood cells, and the red blood cells, of course, that is your blood. And so your blood is responsible for delivering oxygen to all of the cells of the body. So this is particularly important. It also supports skin and eye health, and helps to support the nervous system as well. So this can be also helpful for anxiety. So a deficiency of vitamin B2, bloodshot eyes, burning in the eyes, sensitivity to light, inflammation of the mouth, sore tongue, seborrheic dermatitis, dull or oily hair, split nails, improper functioning of the adrenal glands. So on to B6. Vitamin B6 is pyridoxine, and the active form of that is pyridoxal 5-phosphate. It's important for regulating the mood and preventing mental fatigue. It's needed for the brain to produce serotonin. Serotonin is a hormone as well as a neurotransmitter that's really important for helping to keep your mood elevated. It helps the body to make hemoglobin, and that is the part of your blood that carries oxygen to the organs, including the brain. And vitamin B6 can also help with memory and attentiveness and decrease confusion. So a deficiency of vitamin B6, which also can happen with oral contraceptives, by the way, and I've seen it happen. So anemia, itchy rashes, scaly skin on the lips, cracked corners of the mouth, swollen tongue, fatigue, weakness, and mood changes. So as you can see, some of the medications that are used to treat certain things can also make things worse by depleting certain nutrients that are needed for that same condition. So B6 is definitely one that you may want to consider talking to your physician about, or talking to a natural health expert like myself, so we can talk about, okay, what nutrients might matter for you when you're taking certain medications to offset some of these side effects that are really, in some cases, the effects of having a low level of a certain nutrient. So B12 is the next one that I'd like to discuss, that can be depleted by certain antidepressant medications. It helps to protect the brain, enhances nerve repair, memory, concentration, focus. Needed for the body to make mood-enhancing neurotransmitters like dopamine and serotonin, as we talked about before. And it converts homocysteine to SAMe, and that's another nutrient, and that can actually also help with depression. So a deficiency of B12 can look like palpitations, fatigue, loss of balance, numbness, tingling, sore and red tongue, shortness of breath, dizziness, and symptoms of obsessive compulsive disorder, also known as OCD. So folate is next, and folate helps to reduce heart disease. Most times I think a lot of people know about folate in the context of prenatal vitamins. So it's definitely important at that point in terms of helping to create a healthy baby. So if you are pregnant or just found out you're pregnant, definitely get on your prenatal as soon as possible. So it helps to, again, break down homocysteine. So if homocysteine, this is something you can measure in the blood. If it stays elevated, it makes blood vessels inflexible. And so, of course, if they're inflexible, that can worsen hypertension and increase the risk of coronary artery disease or strokes. So folate helps to reduce that homocysteine. It also helps promote the health and function of the brain and reduces oxidative damage to brain cells. It also stimulates serotonin receptors. Again, serotonin, we said, was a hormone and neurotransmitter that's important for boosting the mood. And it can actually enhance the action of medications used to treat depression, certain medications used to treat depression. So if you have a deficiency or low levels of folate, this can look like depression, epilepsy, cognitive decline, and certain psychiatric conditions. So if you are taking medications for depression, look at the different nutrients that particular medication can deplete or reduce. And if you start seeing some of the side effects that can happen with a low level of that nutrient, that can be a really important time to start supplementing with those nutrients or getting them through the food as much as you can, or even being proactive about it and just start taking certain nutrients when you start the medication. Because as you can see, sometimes medications can deplete the very nutrients that are helpful for maintaining a good mood. So if you notice like you're good on your medication and then all of a sudden you're not and you have to go up in dose, maybe it's because you lost some nutrients that were helpful for supporting your mood. So just keep that in mind. If it's not working as well, this could be one of the reasons why. And so instead of maybe going up on medication, maybe you can think about, okay, if I put this nutrient in with my medication, what would happen? Of course, talk to a doctor like myself or talk to the physician that prescribed it. That would be really important, just to make sure that we're doing something that is enhancing the effect, supporting it, not making you worse. So a natural health expert like myself would be definitely a good person to talk to about that. So I wish you well for the rest of the evening. Keep your head up if depression is something that you struggle with. I do want to say that there's definitely a lot of help out there for you in the natural health space. I focus on prevention, digestion, or gastrointestinal disorders, and kidney disease. So one of the things that I see pretty often when I work with people with digestive issues is that they tend to have mood instability. And so I see depression and anxiety come through when I work with my clients. And so in addition to working on their digestive system, I also help to rebalance their mood. And so they can feed each other. When the mood is not well, digestive system's not well. If the digestive system's not well, the mood may not be well. So as I work on both, I start to see an improvement in both at the same time. And even if all I do is help the digestive system, sometimes the mood will come and increase with that at the same time. So I offer telehealth consultations. You can reach me at drdevonmiles.com. Devon is spelled with an I. Or you can call me at 281-231-2811. And I will talk to you guys later. Have a good evening.